So what is TMJ, and how do you know if you have it? Well, TMJ is short for temporomandibular joint. That's the name of these joints next to your ears that move when your mouth opens and closes. There's a little disc in there. It's a piece of cartilage, and if it gets out of position, then your joints will make noise. They'll pop and they'll click, kind of like your knuckles pop. That can be caused from trauma, like a car wreck, a whiplash. Can be caused from getting your chin hit. Can be caused by a bite that's not right, a bite that's off. Can put these joints out of position. Another thing that can damage those joints is clenching and grinding your teeth for years. A lot of people grind and clench their teeth when they're sleeping, and that damages those joints. So sometimes you'll have popping and clicking and it doesn't hurt. And then a lot of times it will hurt. What happens is after you've had that problem for years, it will typically progress to the point where you start having pain. You'll have pain in the joints. You'll have frequent headaches. You'll have muscle pain. Muscles here in your jaws will hurt and your temples will hurt. So that's a sign that you may have a TMJ problem. How do we fix it if you do have the problem? Typically we make a splint that usually goes on your bottom teeth, and it's got grooves in it for your top teeth to fit into. So when you bite into this splint, it repositions these joints. In other words, it makes them go to where they're supposed to go. Now we're trying to get those discs to slide back up. Sometimes we can get them back up there and sometimes we can't, just depending on how much damage has been done. But the good thing is that the splint holds your joints, or holds your jaw and your joints in the correct position and gets that pain to stop. So you typically wear it for 24 hours, 7 days a week, for about 4 months. And then that allows the joints to heal. And then what we do is we try to wean you off of that splint to where you're just wearing it when you sleep. Sometimes we have to do other things like putting crowns on your back teeth or having braces put on so that we can change your bite. But if you've got pain, if you've got noise in the joints and headaches and pain, then you need to be seen to see if you got a TMJ problem.